In conversation. He's one of India's most respected cardiac surgeons and medical visionaries. He has been instrumental in providing affordable and quality healthcare for all. He's been the recipient of many of India's highest awards, such as the Padma Shri and the Padma Bhushan. He's a medical entrepreneur with an immense passion, vision, and drive. It is my absolute honor and privilege to welcome to the show and to be in conversation with Dr. Devi Shetty, founder and chairman of the Narayana Health Group. Dr. Shetty, thank you very much for your time today.
My privilege.
So let's start with your years in medical school. You completed your MBBS and postgraduate work here in Karnataka, after which you went to complete your cardiac surgery training at Guy's Hospital in the UK. What were some of the similarities and differences you noticed or you observed as you completed medical school in both countries?
There's been a lot of difference, mainly because in India, we do get to see large number of patients, but you're talking about 35, 37 years ago. At that time, we didn't really have access to advanced technology, especially in public hospitals. So our exposure to diagnostics was minimal. Exposure to modern advanced surgery was minimal. There were very few centers doing cardiac surgery. Even if I wanted to be trained in cardiac surgery in India, there were very few options. That's the reason why I chose to go to England. The National Health Service of United Kingdom, I believe, is one of the best healthcare systems any country can dream of. I know they are going through a lot of difficulty. Like every system, it has to change. It has to reinvent itself every few years. But it's a great system, and I really owe a lot. All the knowledge I have got, both in managing patients' illness and managing hospitals and the approach towards healthcare, essentially got itself shaped under the National Health Service. I'm greatly indebted to NHS.
Definitely. And in 1990, or in the 1990s, you became Mother Teresa's personal physician after you performed surgery on her when she suffered a heart attack. So what was your most gratifying experience that arose from your time with her?
See, I'm a doctor, I'm a surgeon. It's very difficult for people like us to look at someone else with flesh and blood like me as God. But I can tell you that Mother was not like us. She was something different. When you sit close to her, you truly felt the divine presence. It's very hard to explain. And those were the best part of my life, wherein the few moments I spent with her. I had the privilege of spending quite a bit of time when she was admitted to the hospital. And I learned so much about life, about the power of love, power of compassion. Yeah, she taught me a lot of lessons, yes.
And we now go to 2001, when you established the first Narayana Health Hospital, then called Narayana Health here in Bangalore. What one led you to initially found Narayana Health? And with such a global vision, where has this all sort of come from?
You see, if any person who has done something in his life, if he says, I had a very clear idea what I'm going to do, he's bluffing. We change, we look at life with a different perspective as the time passes by. And after coming back from England, my main intention was to democratize healthcare. I wanted everyone to have access to high-tech healthcare with dignity. And I try to do it in various ways. And I worked with wonderful organizations in Kolkata and in India. And it was a great learning experience. I worked for two of the biggest, the big business houses, families, and I learned a lot. Then I realized that unless I have the freedom to make mistakes and learn from it, and then come up with a new model of delivering healthcare, which believes in democratizing healthcare, making it affordable more than anything else, the process of delivering healthcare will be enjoyable to the patients as well as the doctors, nurses and medical technicians. So this is what the aspiration was. It is of course very utopian aspiration, but we started in a modest way and we grew. We grew by economy of scale and we grew by the grace of God. Today about 12% of the heart surgery done in India is done by us. For you to understand what the 12% means, whole of National Health Service of United Kingdom, they do about 30,000 heart surgeries a year, and last year we did 17,000 heart surgeries. So it's a very large number, but our aspiration is to reach about 30,000 heart surgeries a year. And if we reach that number, we believe the cost of healthcare, cost of heart surgery can come down further.
And since then, as you pointed out, there have been several other Narayana Health hospitals constructed not only across India, but also internationally, with one currently in the Cayman Islands. Where do you see Narayana Health, say, 10 years from now?
I believe that digital health will dramatically change the way healthcare is delivered. Healthcare industry will undergo changes which will be beyond recognition. I'll give you one simple example. Like we are working with Microsoft. Microsoft has a platform called Kaizala, which we are adopting for delivering healthcare in the hospital and outside the hospital. So this software will allow every citizen of the planet to have their medical records in their own phone, entire medical records. So with a click of a button, you can send your reports to any doctor of your choice. Then doctor can scan all those reports, see everything. Then with a click of a button, he will be in touch with you through a video conference, through Skype. So patient is sitting in his house, maybe in his bedroom. Doctor is sitting in his car or his holiday home. And they can communicate with each other. And every data he wants, doctor wants, it is in front of him. See, I have been personally involved with telemedicine over 17 years ago. I treated more than 53,000 heart patients through remotely with telemedicine before internet ever existed, before internet came. Because there are only 5 countries in the world which can put satellite on the space, and India is one of those countries. So we had our own satellite connection given free of cost by Indian Space Research Organization. So we were linked to few hospitals in Africa, all the remote location hospitals in India. And I could see any patient, his reports, and talk to the family. Any patient who had a heart attack in government public hospital, in any remote location, most remote locations, I could see them and talk to them. But I didn't have the comfort of having the entire medical records in front of me as I was talking to the patient. That is very important for every doctor. And now, today, it is possible to have all this data in your own mobile phone. So, we believe that digital health will dramatically change the way healthcare is delivered. And the change agent is going to be the software in the mobile phone, not a desktop.
And as we all know, Narayana Health has been extremely successful with its economies of scale model. So as you aim to change the way healthcare operates in India, do you look to eventually have your work influence healthcare systems in other countries, such as the US, in the future?
The one reason why we chose Cayman Island is because of its proximity to US. If the healthcare has to change, US has to change. Because if US changes, every country, including India, changes. Americans may not accept, but they are the leaders of the world. And they set the standards, at least as it stands today. The reason why we looked at Cayman is the Caribbean region is a very fascinating area for us, mainly because there are about over 40 million people living in those regions. There are 29 island nations, and there are 7,000 islands. Some islands are only 30,000 people, some have 50,000, 200,000, 500,000, 1 million population. And the population is too small for them to have a cardiologist or a nephrologist or a neurologist living in those islands. But people do fall sick. They need access. So our desire is, with the Kaizawa platform, we want all the islanders living in small islands to have their medical records on their phone. And when they are sick, with the click of a button, they can have a video conference with our doctors in Cayman Island, and they can advise the patients. By doing it, we believe that the outcome of care, especially disease like diabetes, we have now data of over 40,000 diabetic patients in our system. And when we started monitoring them remotely, we realized that there has been a 20% improvement in the glycosylated hemoglobin level, which suggests that the sugar is better controlled. By remote monitoring rather than looking at them physically. So now we tell our diabetes patients that you need to see us, the diabetology team, once a year. But any time when your blood sugar goes up and down or any problem, with click of a button you can send us a message. And within 2 hours we will sort out your prescription. So this is, you see, over 62% of the diseases are degenerative diseases. Once you are diagnosed as having diabetes, lifelong you are a diabetic. You have a heart problem, lifelong you are a heart patient. You need constant monitoring. As a doctor, I can't say that when you walk out of my premises, I have no responsibility for you. We want a specialist doctor in every patient's pocket. We are not looking at you getting an appointment and waiting for hours together to see us. We are at your service. We are in your pocket. Pull out your phone, with a click of a button, we are available to you, round the clock.
So, coming back to India briefly, where, do you think the Indian medical education system stands today?
We have, like every country, we have a problem with our healthcare delivery model in medical education, nursing education, but it's getting reformed. First thing is we have a acute shortage of doctors. We need at least 2 million doctors. Because unlike in the past, in good old days, if somebody graduated as a doctor, he always practiced medicine. Today, significant number of doctors after graduation don't practice medicine. They get into software or the management and the research and so many attractive offers they have. So we need to train a lot more doctors, and there is a huge requirement. World Bank predicts that there is a need for 80.2 million healthcare workforce in the next 10 years, 11 years. So we have a great opportunity to train at least a good number of those doctors, nurses and technicians. And I believe that medical education, whether it is in India or overseas, should become like an apprenticeship model, wherein we shouldn't look at the edifice of the complex. We should just look at how busy the hospital is, how good the doctors are, and each doctor mentors 3, 4, 5 doctors, young students. And virtually all the teaching material is available online. And you have a good repository of all this data. We can produce fantastic doctors who are practically experienced, practically skilled. Yeah.
And what makes up an exemplary physician to you?
That's very interesting. I look at every country going for a competitive exam to choose who's going to be a doctor, who's going to be an engineer, who's going to be a surgeon. I think that's a very, that's a stupidest way of deciding who's going to be an outstanding surgeon.
Right.
I failed in so many exams, and today if I have to get admitted for a surgical training program, there is no way I can get admission with my academic excellence, my performance, because I have a serious problem in passing exam. It's not that I am a bad student. I have excelled in several exams, but it is a huge effort because my heart is not there. But I can work continuously in the hospital or in the ICU for months together without even going out of the hospital. I can sleep on a patient couch or on the floor, and for months together I can take care of the patients. I see one operation, I can do much better than most of the other surgeons. But you ask me to appear for an entrance exam, I won't be able to pass. So we have to dramatically change how we identify doctors. And answering your question, who makes a good doctor? It is not the one with the greatest academic excellence. It is the one with the passion, dedication, focus. And I strongly advocate anyone who looks at work-life balance, don't take up medical profession. This is one profession wherein you need to be eccentric to excel. Because you can't justify the hours of work we put in. So, and it's not like one-off event, it's a daily occurrence. It's a tough profession. But if you ask me whether if I have another life, and if I come back to this world again, what I want to do? I want to do exactly the same thing what I have done. Yeah.
Speaking of this work-life balance, do you ever get stressed? How do you de-stress and still, always manage to exude this positive energy?
You see, when you enjoy your work, when the work becomes like a play, you don't get tired. I see about 60 to 100 patients every day sitting on this chair. And I do at least 1 or 2 surgeries every day, and I work 6 days a week. Like I landed from Delhi yesterday night around 2 o'clock or so. I went to bed at 2 o'clock. And this morning I am up and I started seeing patients, and my patient is on the table and shortly I'll get cut up. And I'm as energetic as I am in any other day because it's very intoxicating, it's very exciting. See, this is a fantastic profession wherein you get a chance to become a hero in real life and in a dramatically short period of time. I'll just give an example. I operate on a large number of kids. I operate on adults. A typical patient of mine, a little baby who's blue, the so-called blue babies. The baby is gasping for breath, and the baby is held by the mother and the father and everybody crying. You explain to them about the surgery. You take them to the operating room. 4 hours later, you come back, and the baby surgery is over, baby is in the ICU. Then I call the parents. I call the mother and show her the baby that surgery is over, you can see your baby. And not infrequently, the mother looks at the baby and she says, "This is not my child." Then you tell her that this is your child. She look at me and say, "He was very dark before." I say, "Yeah, he now looks pink and that's what he is, that's his color." And then she gets reassured and she touches the baby. And the next question she asks is, "Will he always remain like this?" I say, "Yeah, he's going to remain like that forever." See, you bring about transformation in people's life in 4 hours. Tell me which profession you can touch the lives of millions of people on a daily basis. And of course it's a tough profession because this is the only profession where the discussion happens between the customer and the provider of service in business terms. The discussion is about the death. It's a very stressful profession that way. But then, as long as you are true to yourself and you explain to the family that this is the problem, this is the solution, these are the risks, these are the consequences. If you trust me, I will do the operation. If you have any reservation, you want to get second opinion, third opinion, get somewhere else surgery done, no problems. We need to be very honest and very clear. Then there is no ambiguity. And we never project ourselves as gods who can cure everything. We have to make it very clear that you are only a technician. You are like an instrument in the hands of God. That's all. We'll do whatever is possible with assuming that the child is, if it is my child, I will do the same thing to your child. That's it. But I'm only a human being like you and I have many limitations.
Absolutely. And lastly, for our youth viewers in the audience, if there is any one piece of advice you could give to an aspiring doctor, what would that be?
First message I would like to give to them that it is the greatest profession on this planet. But they should take it up if their heart genuinely believes that this is what they want to do. They should take up the decision because the parents want him to be doctors or peer pressure or the glamour or the money or this. If they ever decide that as a motivating factor, they will become very poor doctors and they won't be happy. Because this is a very stressful, people who don't like the profession, it can be very stressful. And it's a lifelong profession. Once you become a doctor, you're a doctor for life. But this work desperately requires passionate doctors with magic in their fingers. They can go to any part of the world and make a huge, huge difference. And in the end, when they finish their innings, they will have no regrets. And they would have touched the lives of millions and millions of people.
Absolutely. Truly resounding words right there. And with that, thank you very much once again for your time. And it's been a real pleasure speaking with you, Dr. Shetty.
Thank you. All the best. God bless.